Hi, good morning. Thank you very much to the IAS conference for the opportunity to present the initial results on the PrEP Brasil demonstration project on behalf of the team and the participants. Today, I will be presenting you data on PrEP uptake and its associated factors among MSM and transgender women in Brazil. These are my disclosures. So our study was entirely funded with local Brazilian funds through the Brazilian Ministry of Health, the Oswaldo Cruz Foundation, and research agencies from the Rio de Janeiro and São Paulo states, and study drug was donated by Gilead. So based on studies that showed high efficacy of PrEP among MSM, transgender women, and serodiscordant couples, in 2012, the WHO recommended that demonstration projects be conducted in settings where these populations were at higher risk for HIV infection. In 2014, guidelines were released recommending PrEP for MSM and transgender women. Nevertheless, the feasibility and interest of these populations in this prevention strategy in real-world settings from low and middle-income countries are unknown. In Brazil, MSM are disproportionately affected by the HIV epidemic, particularly those younger than 25 years old. While HIV prevalence among the general population is 0.6, in MSM it reaches 14.2. It's particularly high in Rio de Janeiro and São Paulo, where prevalences of 17.6 and 15.4 were found in recent studies. PrEP Brasil is a multi-center, open-label PrEP demonstration project where Truvada is provided orally once daily. Main objectives are to assess the uptake, safety, and feasibility of PrEP implementation provided at no cost for high-risk MSM and transgender women in the context of the Brazilian public health system, and several secondary objectives were included. PrEP Brasil is being conducted in 3 sites. At Fiocruz in Rio de Janeiro, at the Referral Center for HIV Treatment, and the São Paulo University, both in São Paulo. In Rio, individuals getting tested at Arco-Íris, an LGBT NGO, and at a mobile testing unit located in a hotspot, were also assessed for potential eligibility for PrEP Brasil. Participants had to be MSM or transgender women, have 18 years of age or more, and meet risk criteria for HIV infection, defined as, in the last 12 months, having 2 or more male condomless anal sex partners, or 2 or more anal sex episodes with an HIV-positive partner, or an STD diagnosis. And listed here are the exclusion criteria. Social and other media were used to advertise the project, and these efforts to advertise paid off as the project had a great repercussion in the local media. It's not working. Today, I will be presenting the data and results regarding PrEP uptake and its associated factors in the PrEP Brasil study. So, from April 2014 to April 2015, participants were assessed for eligibility during a pre-screening visit. At Fiocruz and CRT in São Paulo, they were either self-referred for PrEP or were assessed for participation during HIV testing or when searching for post-exposure prophylaxis services. At USP, the second site in São Paulo, all participants were self-referred for PrEP Brasil after hearing about the project in the media and Facebook and etc. In the pre-screening visit, individuals were assessed for demographics, HIV risk perception, behavior questions according to the study's sexual risk entry criteria, HIV serostatus, awareness on PrEP and other HIV prevention methods, and willingness to use PrEP. HIV rapid test was performed. If potentially eligible, they were invited to participate in PrEP Brasil. Refusal reasons were noted. Those who accepted were further evaluated at screening for sexual risk behavior, repeated HIV testing, pooled or individual HIV RNA, renal function, and hepatitis B testing. The enrollment for those eligible was scheduled within 45 days after screening, and assessments were done as shown here. Individuals could formally refuse to participate in any of the visits or simply not show up in the subsequent scheduled visit. In any of the circumstances, they were considered as declining to participate in the study. PrEP take was defined here as the proportion of enrolled individuals among those who were potentially eligible at pre-screening. This proportion was calculated overall and for each independent variable. A Poisson regression model was used to evaluate which variables were associated with PrEP uptake. Individuals who had prior PrEP use, meaning they participated in IPREX or IPREX-OLE, were excluded from this analysis. So, 986 individuals were approached at this pre-screening visit at the 3 sites. Of these, 188 were ineligible, and 798 were potentially eligible and invited to participate in PrEP Brasil. 21 of them refused, and the main reasons for refusal were lack of time and fear of side effects. 287 of potentially eligible individuals who accepted to participate did not show up for the screening visit. Then 490 individuals were screened. There were 32 screening failures, and the most frequent clinical or lab-related reasons for ineligibility were an HIV-positive result, severe clinical comorbidities, and proteinuria. 36 individuals did not show up for the enrollment visit. 422 individuals were evaluated. Of these, 12 refused, claiming they were not interested in participating in the study, and 1 individual was ineligible. At the end, 409 individuals were enrolled. Overall, PrEP uptake, or the number of enrolled divided by the number of potentially eligible at pre-screening, was 51%. Most of the enrolled individuals were from the Rio de Janeiro site, had 26 to 35 years, 12 years of schooling or more, and reported a steady partner. Of note, 31% of the enrolled participants had between 18 and 25 years old. Overall, 94% of the participants were male and 6% were transgender women. 84% of men self-identified as gay. Bivariate analysis showed statistically significant differences regarding PrEP uptake. Uptake was higher at São Paulo, at USP, one of the São Paulo sites, which is probably associated with the fact that all individuals at that site were self-referred and not approached during PrEP services or HIV testing, as occurred both at CRT and Fiocruz. Whites and those with a steady partner also showed higher uptake. Uptake was higher among those with higher risk perception as well as higher risk behavior, as indicated by increased number of partners in the last 12 months, reporting of anal sex with an HIV-infected partner, or a history of STD. All these variables were found to be associated with increased uptake in the bivariate analysis. In the multivariate model, controlling for age and education, predictors of uptake were having a steady partner, being trans, having performed an HIV test in the last 12 months, prior PrEP awareness, and having had condomless anal sex partners in the last 12 months. Again, the higher uptake in the São Paulo sites was probably related to the fact that individuals were mostly self-referred as opposed to approached when presenting for HIV testing or PrEP services. The higher uptake saw among trans may be related to the concerted and targeted efforts on trans community peer education on PrEP that was done in Rio de Janeiro, where 80% of the trans were enrolled. That said, care should be exercised when interpreting these results, given that trans represented 6% of the study participants. As expected, riskier sexual behavior, higher HIV risk perception, and higher levels of PrEP awareness were predictors of higher PrEP uptake, as previously demonstrated in other studies. In conclusion, this is the first PrEP demonstration project for MSM and transgender women without prior PrEP experience in a middle-income country. Overall, we found that PrEP uptake was high. Interest on PrEP in the MSM community was high. Targeted trans community education activities and a trans-friendly environment can play a major role in getting trans people to access PrEP services. The higher uptake among those at higher risk and prior PrEP awareness emphasizes the importance of establishing strategies to improve HIV risk perception and PrEP awareness in the MSM and transgender communities in Brazil. I want to acknowledge the contribution of the participants, the teams, colleagues who provided support in several aspects of the project, and of course, Gilead and our funders. Thank you very much for your attention.
Thanks very much, Beatriz. I don't know if we have questions coming